Hi, everyone. I'm Tamara Taggart. Like many of you, I've been hearing a lot about variants in the news when it comes to COVID-19, and I have a lot of questions and concerns. So I reached out to Dr. Colijn, who is a mathematician and COVID researcher, worldwide respected and working out of SFU. Thank you so much, Dr. Colijn, for being here. I really appreciate it.
Hi, thank you.
So I know you and your team are very busy, and you've been working on so many things in the last year, but what are you focused on right now that we're a year into this?
Yeah, so this is me and a team, I should say that. So we do a lot of different research around COVID. And I guess the three things we're really interested in right now are vaccination. What's it going to look like? How can we best use the vaccines? The new COVID variants, what those might look like and how they might affect the curve and what to look out for and what we need to do. And then issues around testing and really focused around how to stop transmission, stop the variants, stop transmission with vaccination, stop transmission with testing, how to stop COVID.
Okay, so daily we're seeing, it feels like we're seeing our curve go down, our numbers going down, which is a good thing. But is there a hidden curve that maybe some of us don't know about?
Yeah, exactly. I think that's the worry that, it's sort of hidden and sort of not. We're learning more every day as different provinces look for variants using the different technologies that they have. But of course, if we have a few hundred cases a day and there are 10 of a variant, we won't know that unless we look and report it. And the risk is that those 10 can become 20 and then 40 and then 80 with a faster doubling time than our normal COVID. And our normal COVID could be even declining, but those could be rising and we won't necessarily know. So it could be kind of a part of our curve that we don't see unless we really look very carefully and then report that.
Mm. Okay, so it feels like we've been under restrictions for a very long time. I mean, we're a year into this. A lot of us have stayed home for a year. Is our province doing everything we can? I guess, are we using all the tools in our toolbox?
Yeah, so I think that's really hard because we are so sick of it and we are all doing so much. And so no one wants to hear, oh, like we're not doing enough. And I think we could do more in several ways. And to me, one of the things we're not using is rapid testing. That we have been given, the federal government has given the provinces a total of, I don't know, 17 or 19 million rapid antigen tests, which are not as brilliant as your PCR test. They're not quite as good, but they're good enough to screen large numbers of the regular population and check for COVID. And then the people who test negative, much, much safer to go ahead with their normal activities, maybe enter a long-term care home setting or do some other activities. These have been used in the US to reopen universities. We have universities open. We have people in their 20s and 30s living their normal lives supported by, screening every week. And then if you test positive, just like a home pregnancy test or any other kind of screen that your GP might have, you then go get it confirmed. You don't like go buy childcare when you get your home pregnancy test. So it could work kind of like that and really support a lot more opening. And I think we will move that way. Justin Trudeau mentioned it this morning. And I think they will start doing it. But to me, the fact that, we care so much, but then we didn't roll out these tests. We're also not controlling our importations as much as we should be. And, maybe that doesn't matter when we have widespread transmission, but if we're declining, those imported cases from other jurisdictions, from Ontario, from Alberta, from the US, from international flights, those matter. And they matter more if they're not a drop in a huge bucket. If they're a drop in a tiny declining bucket, then they matter more. So I think that's another thing we could be looking at.
Right. And you talk a lot about just closing, like shutting everything down for 4 weeks or shutting everything down, like everything down. Would that help us get ahead?
So it would and it wouldn't. So one of the things we argued for starting in December was this idea of the Canadian shield. So do something strict, do it now, get all the way down to a really low number of cases where we can do all our contact tracing and we've got lots of public health capacity. That can be used to roll out rapid testing and other ways to support reopening. tighter measures at the borders, some of which have happened, happy to say, but even tighter to keep introductions out. And then we could have months and months where we live more like they're living in New Zealand or Australia. And we could, even though we're not an island, New Zealand has that nice advantage, it's an island. We do have some island-like places. We have Vancouver Island, we have Prince Edward Island, we have the Maritimes. They've been able to do a fantastic job, even though as a collective, they're not an island. And so we could be doing that in Canada. We could be not just going completely COVID zero, because we'll probably never see absolutely zero, but do something now for 4 weeks, define time period, reach out to people, say, this is the plan. We have a strategy. It's not just do this forever and then keep talking about 3 more weeks, 2 more weeks, 4 more weeks. It's do this now strictly with a reason and a rationale and say, this is how we're going to move to reopening. This is the plan. So I think that would be helpful for people because we're all so sick of it. And I think there's a risk that, we have the new variants, we have vaccination, there's kind of a race, but we're not going to win it with vaccination. And so having a way forward and a way out of this that we can believe in together, I think would work. It worked in BC the first time. Everybody was very together. We had a very strict shutdown, but we really made a huge difference in a short time. And we could be doing that again. It's not worth it if we don't have that next plan, though. It's not worth it to just be strict and locked down and then go ahead and reopen and have a rapid rise. And I think that's the kind of thing we want to avoid, is just more and more waves of, let's see what happens if we reopen. Oh, look, it was transmission.
Yeah. Yeah. Okay. Last question, because I know you're busy. What keeps you up at night?
Oh, good question. Okay. I think, the fact we're not using all the tools in the toolkit, the rapid testing, the fact that we care so much about the deaths in long-term care that we're willing to shut down so much of the population's social activities nominally to prevent, deaths and hospitalizations, but we're not willing to do that with rapid testing. So, and we are, I think that'll change. And then the other thing that keeps me up at night is around the vaccines. I think as we get more and more data for how well the vaccines work at preventing infection, we know they prevent symptomatic disease. They're great, we want them. But if they prevent infection too, and I think they do, then we can start using them strategically. We can start saying, okay, all those people in frontline jobs who have to have contact, we can vaccinate you and protect you not only from getting sick if you get exposed, but from getting exposed in the first place. And we can actually get a lot of mileage out of that. So that's one of the things we're working on now, is just drilling into, can we do that with vaccines? And if so, how would we go about it and how well would it work?
Awesome. Well, thank you so much for everything you're doing and your team is doing. And I really appreciate you taking the time to have a quick chat. Thank you.
Absolutely. Thank you.